Hello, back again, Dr. Coring with another episode of Real Health Talk with Dr. Coring. Again, my name is Dr. Coring. I am a board certified internal medicine physician as well as a hematology oncology fellow who is training to become an oncologist. And it's my pleasure as well as my passion to educate common folks such as yourself regarding various health topics to improve wellness. And today I would like to talk about anxiety, specifically stimulant induced anxiety. And so this episode is for people who have maybe noticed that they get a little bit anxious, especially after taking or drinking coffee. And so, have you noticed or ever noticed that after you take or drink your morning coffee or your morning caffeine, that you become extra jittery, extra stressed, extra on edge, extra moody? If you have noticed that, it could be something called caffeine induced anxiety. That's right. That's a diagnosis essentially stating that if you're ingesting this substance, which is caffeine, which is known to be a stimulant, and have these symptoms such as nervousness, jitteriness, moodiness around the time that you're ingesting this substance, and also have realized that without the substance, you don't have these symptoms, you may have caffeine induced anxiety. And the reason why I think this is important and this is an important topic to discuss is because if you have baseline anxiety, meaning, without caffeine, you already have a level of anxiety and have noticed that this level of anxiety may have increased or may increase, or your symptoms may be worsened around the time you drink or ingest caffeine, then this can lead essentially to panic attacks. And that's the concern that I have for my patients or people in general who notice that they are more sensitive to coffee and caffeine than others. And so I want to warn, common folks such as yourself or people with baseline anxiety that, you know, ingest coffee, such as, myself. I, quite frankly, it's hard for me to function in the mornings without coffee. However, if you're a person who is difficult, it is difficult or have become difficult to function without coffee or your AM or morning coffee, you notice you perform better when you drink your coffee in the morning. However, you also notice that you have these symptoms such as nervousness, jitteriness, increased stress. I do want to warn you that you are at risk of, or maybe at risk of panic attacks if you have these symptoms and you have an underlying diagnosis of anxiety disorder or even panic attacks. And so I want to not only warn you of this, but also give you alternatives. I am not the person to ring the alarm without giving solutions to solve the problem of why the alarm is going off. So definitely we're going to talk about some solutions, reasonable solutions. But let's first talk about caffeine and the things or the symptoms that excessive caffeine can cause. So we talked about anxiety and how does that present? Well, again, nervousness, jitteriness, increased stress, irritability, mood swings, increased panic attacks. So if you already have panic attacks or anxiety disorder and you notice that you're having more frequent panic attacks, really, really ask yourself, what is my caffeine intake like? Am I drinking or intaking too much caffeine? And we're going to talk about that. We're going to talk about the daily required or the daily recommended amount of caffeine per day. So anxiety, just going back to, some of the symptoms excessive caffeine can cause. We talked about anxiety, insomnia, meaning trouble sleeping. Um, there is evidence that suggests that if you drink too much caffeine, or especially if you're drinking caffeine closer to the time that you normally would want to go to sleep or get some rest, uh, then we understand that you can, not have quality sleep or rest, and also can have sleep disorder such as insomnia. So the recommendation here is not drinking or intaking too much caffeine, especially 6 hours before you normally, go to bed. So we say the morning coffee is fine, maybe another, caffeinated beverage and at noontime, but after 2, 3 p.m., then it's not a good idea because it can keep you awake at night. Another common side effect of excessive caffeine is diarrhea and or acid reflux. So gastrointestinal side effects. The gastrointestinal side effects of too much caffeine, it's a stimulant. So it can stimulate the bowels and cause diarrhea, as well as it relaxes the sphincter that essentially connects the esophagus to the stomach. And that valve or sphincter, if it's relaxed, caffeine does a good job of relaxing that valve. It can cause acid reflux, meaning the contents in the GI tract, mainly the stomach, because it's very acidic contents in the stomach, could reflux or back up or backflow up into the esophagus, which can cause irritation of the esophagus. You feel that in your chest and in your throat. That's called acid reflux and can essentially develop into something called GERD or gastroesophageal reflux disease. All right. And so it can become a disease, in fact, meaning chronically happening, changing how the esophagus look inside because of the acid just continuing to reflux. So if you already have acid reflux or GERD at baseline and you're drinking too much coffee, that can make things worse for you. Caffeine can also affect the heart. There are cardiovascular side effects of excessive caffeine intake. It can cause high blood pressure because it's a stimulant. It also can increase the heart rate because it's a stimulant. So if you already have high blood pressure, you're already taking medications for hypertension, then excessive caffeine may not be a good idea for you. All right. If you already have irregular heart rate, maybe you have atrial fibrillation, maybe you have ventricular tachycardia, maybe you already have heart issues, excessive caffeine is not a good idea for you. And the last thing I want to warn you about is fatigue. Yes, we take coffee to stimulate us, to get us energized, but that comes with a consequence. Eventually that wears off and you crash hard, especially when you intaking too much caffeine. All right, and that hard crash looks like fatigue, and so therefore people notice that after they come off that caffeine high, they just sluggish, and so that makes us get even more coffee, and it leads to essentially a vicious cycle, and that leads to excessive intake, which brings me to my next point. So you may want to ask, or you may now wonder, well, what is it? Excessive intake of coffee? I'm glad you asked. So studies suggest that greater than 400 milligrams of coffee in a day is excessive. And let me give you some context. Typically, a regular cup of coffee is about 100 milligrams. All right. And so, you know, we recommend a daily intake of 200 to 400 milligrams, no more than 400 milligrams. So that's roughly 2 to 4 cups of coffee per day. All right. That's coffee. All right. And so the daily intake, 400 milligrams max, 200 to 400 milligrams range per day, 2 to 4 cups of coffee. Now, I'm going to be honest. In the morning, 2 cups, that's me. And towards noon, I need another cup. So I'm already at 3. But, some people drink coffee throughout the day, and that's just a regular cup. I'm not talking about the grande or the venti. I don't know. Starbucks, they have these weird ways to order a regular size cup of coffee. And so we're just talking about a standard cup of coffee. All right. So it brings me to solutions. How can we reduce our caffeine intake? I'm glad you asked. Tea. Tea. I like tea. The reason why I like tea better than coffee is because one, a cup of one cup of tea has less caffeine, almost half the amount than one cup of coffee. And also, the caffeine is a little bit different, meaning how the caffeine essentially is released into the body. It's different in tea versus coffee. You see, in coffee, you get all of that caffeine all at once, and so it hits you fast, but you crash fast. Versus tea, you get the caffeine, but it's slowly released into the body, so you don't crash as fast, and it lasts a little bit longer. However, you may find that you need more tea to meet your demand. And so we have to wean ourselves off of coffee. And I'm recommending, if you know that you are a 6 cup a day person, or you are 1,000, milligram per day person, and your anxiety is now worsening, and you know now, especially after listening to Real Health Talk with Dr. Coring, you understand now that you may need to wean down your caffeine intake because you need to get better control of your anxiety, or maybe you need to get better control of your hypertension. How can I do this, Dr. Coring? I'm glad you asked. Let's start drinking tea, because you also do not want to withdraw from coffee as well. Coffee withdrawals sucks. You're tired, you have headaches, you're fatigued, you're sluggish. So to prevent that, we need to wean ourselves down using tea. So how do we do that? I'm glad you asked. So if you're a 4 cup of coffee per day drinker, let's go down to 2 cups of coffee per day, and those other 2 cups that you're losing, let's substitute that with tea. That will start to reduce your intake. So if you say, hey, Dr. Coring, I drink 4 cups of coffee per day, all right, I will say, okay, let's do 2 cups per day and also 2 cups of tea. So 4 drinks per day instead of 4 cups of coffee, you're doing 2 cups of coffee and 2 cups of tea. Do that for a week. Then the next week, you could do now 1 cup of coffee, 3 cups of tea. Do that for a week. Then the next week, you can do now maybe a half a cup of coffee and 3.5 cups of tea, until you just now only drinking tea. And when you go from coffee totally now to tea, you reduce your coffee intake by half, simply because coffee is half as much of caffeine as tea. And I say you reduce your coffee intake by half. I meant to say you reduce your caffeine intake by half, because coffee has twice as much of caffeine than tea. So what I'm essentially trying to say is, try to substitute coffee for tea, but you can't do that all at once. You need to slowly taper yourself on to tea. By transitioning from coffee to tea, you essentially reduce your caffeine intake by half, which is pretty good. And especially if you suffer from diseases such as anxiety, panic attacks, hypertension, irregular heart rate, it may be beneficial, highly beneficial to your health, to start to reduce your caffeine intake. And my best solution is by using tea. And tea also have other added benefits. They have different types of herbal teas, which can be good for your mood, can be more calming, could be more relaxing, could put you in a better mood, could be soothing as well. So tea has its benefits. Not only does it give you coffee, it gives you more mental health benefits as well. All right, guys, that's my time. I love you guys. Peace and love. Remember, caffeine can be good, can give you energy, but also have some side effects that could worsen or exacerbate underlying issues that you may already have, specifically anxiety and panic attacks. Caffeine can make that even worse. Try substituting your coffee intake with tea. All right? Love you guys. Peace.